The question is, which is the best treatment actually to restore in a non-invasive way your hair without reaching any transplants? And the answer is, you gotta do it in 3 steps and you gotta do it progressively. On the first part of the treatment, we start with platelet-rich plasma in combination with some growth factors, in addition to adding laser and PDO threads. That will induce an inflammation and it will fertilize the ground before we reach the second step. On the second step, we still use some of the fertilizer, the PRP, some of the PDO threads that cause the inflammation and induce actually proliferation for some stem cells. But in addition, we can add also like autologous stem cells. That means from your own. We extract them from fat, we hyperconcentrate them, and we put it in your scalp. Or, alternative for other patients that don't have the fat, will be using exosomes. Then we actually activate them with laser technology, with low energy, with erbium, in between 4 to 7 joules. In addition, the third step will be actually going back to the fertilizer. We got the stem cells in place. Now we want to keep them fertilized so we can induce the use of PDO threads in areas that we haven't targeted yet and add more PRP and growth factors to allow the patient to have a more even distribution and formation of new hair follicles. The protocol actually has worked in younger population as well as people that are in the 80s and 90s. Now, what is the difference for success? If the period of your hair actually you started losing your hair within 5 years, the closer you are to the 5 years, the better chances for success you have. After 10 years, it takes a lot of effort actually to regrow hair. That doesn't mean like you're not gonna grow hair. You are gonna grow it. Like for example, in my case, I wasn't a candidate for even hair transplantation at all. And now I didn't have any hair in this area. And that's the harvest area. Now I'm starting to grow hair on the scalp and I have solid hair actually in the harvest area. Now you can see potentially this hair can be transferred from here to this area. So we do actually allow patients, not even for hair transplantation, but to allow them to go through the option of non-invasive treatments to be possible candidates or potential candidates for future hair transplantation. So either way, it is a win-win.